The Fen-Phen saga is a case study in what happens when clinical metrics are prioritized over biological common sense. For years, weight loss focused on the metabolic shift, but Fen-Phen moved the target only to the brain and the brain's internal chemistry. It was an experiment in recalibrating the body's hunger signals that worked until the physical structures of the heart didn't. Fen-Phen wasn't a single pill. It was a pharmacological pairing that became a global phenomenon in the mid-1990s. By combining two specific medications that had been on the market for years, researchers found a synergy that appeared to solve the most difficult part of weight loss, the constant biological urge and craving to eat. At its peak, it was prescribed to millions who finally felt they had the upper hand in the key to their own appetite and therefore their own weight loss. So Fen-Phen, the Fen with an F, was fenfluramine. Its primary job was to flood the system with serotonin, and that serotonin acts as a fullness signal. It tells the brain you've had enough and it's time to stop eating. The problem was that fenfluramine was just kind of like a blunt instrument. It didn't just target the brain, it interacted with similar serotonin receptors throughout the entire body, including those that help maintain the structural integrity of things like your heart and its heart valves. The Fen, with a pH, was Phentermine. This component was more surgical, triggering the release of norepinephrine to hit the brain's hunger centers from a different angle. By pairing a serotonin releaser with a norepinephrine releaser, you got a double whammy of appetite suppression. You weren't just full faster, the urge to start eating was dampened before you even opened up that fridge. Together, these drugs created a state where patients were often indifferent to food, silencing that food noise that drives overeating. By 1996, with 18 million prescriptions written annually, it was considered a success. That changed when the Mayo Clinic began seeing women with no history of heart disease showing up with stuck heart valves that had been immobilized by thick fibrotic buildup. An issue that arose with this combination is that synergy actually kind of created a pharmacological offset. Fenfluramine itself lowers both the heart rate and blood pressure. Phentermine raises the heart rate and the blood pressure. The combination looked safe because the heart didn't appear to be under stress, but this was, like I said, an outward mask. In reality, the Phentermine with the pH was maintaining these stable vitals, while the fenfluramine with an F was silently damaging the heart valves. This serotonin overload triggered a fibrotic response, essentially coating the heart valves in a dense layer of scar tissue that prevented them from closing properly. The FDA pulled fenfluramine with an F in 1997, but the demand for those results didn't just go away. And this led to Fen-Pro. To fill the void left by fenfluramine, some attempted to swap it out for Prozac. The logic was that since Prozac is a selective serotonin reuptake inhibitor, or SSRI, it should help keep existing serotonin in the synapses rather than flooding the system like the fenfluramine with the F did. It was a way to maintain that fullness effect using a different drug through a similar mechanism. But our biology is interconnected. It's not a set of individual little itty-bitty systems. Swapping out one serotonin-altering drug for the other doesn't guarantee the rest of the body won't react to the change as well. Using an antidepressant to mimic a withdrawn diet drug is what happens when the desire for a quick fix and a quick buck outweighs long-term safety data. So we just move from impacting the heart to tinkering with the chemicals that regulate mood and depression to manage our appetites. I'm going to go off script for a bit because Fen-Pro is still available. Phentermine is still a prescription, Prozac is still a prescription, and they're both out there. However, it's really never, if at all, used anymore. There's better alternatives, there's safer alternatives, and it's a lot safer to use medications that they were designed and actually studied for. This lesson is a matter of common sense. When you use one drug to balance out the physiological side effects of another, you aren't maybe solving a problem, you may potentially just be creating a new one. Fen-Phen proved that we can successfully quiet the brain's desire to eat. But not this way. We need a much safer way to do something like that. I'm Data Driven Doug. Every month I unravel a fresh topic dissecting the whole thing through daily shorts, weekly side quests, and full-length deep dives, plus quizzes, polls, and some interesting looks at things that are just scientifically captivating to me. If this sounds like your brand of curiosity, you know what to do. Thank you very much for watching. Don't guess. Data test.